to dig further into the HMPV, what to do, what are the preliminary safety tips. I'm glad to have a medical research scientist, Dr. Casmir Ifeanyi. He's joining us now on Primetime. Casmir, glad to have you.
Yeah, glad to have you.
Yeah, like you had me alluded to the fact that I was discussing a while ago with the Minister of Health for State, Isaac Adekula, and I was asking him, is the acknowledging thing is surging in China, people are wearing face masks. Should we be agitated?
Well, we have every reason to be agitated as a nation because a disease in any part of the world is a disease everywhere in the world. You see, 4 years ago or thereabout, at about the same time, between November to December, diving into the Yuletide seasons, period, yeah. We had the denied and the later accepted outbreak of COVID-19 coming from the same region, same country, about the same time. Now, anything happening in China, the world should be alarmed because China is a global hub.
Global hub.
Yeah, global hub for education now.
A melting pot.
A melting point for commerce. So all parts of the world coalesce, even the world powers, go to China to produce for consumption in their home country. So China is a global hub. Like you use the word, a melting point. And so if a disease of this nature that is respiratory, airborne, and it's happening again in China, the whole world would need to roll up their sleeves and get ready. But not to panic anybody in particular, because I want to honestly acknowledge the efforts coming from the Federal Ministry of Health and the Nigerian Center for Disease Control. They are not laid back at all in this matter. The Honorable Minister of State, Dr. Ishak, just left here, and I'm happy he's up and about providing information and doused intention and guiding Nigerians aright on what government of the day is doing. And so we're not laid back. I do not think the country will be caught napping. The Nigerian Center for Disease Control had also evaluated their data, working in concert with the Federal Ministry of Health and Social Welfare, looked at the Nigeria Influenza Sentinel Survey System, and on the basis of that data, they've been able to classify our risk profile as a nation to the human metapneumotic virus, HMPV, and they've said Nigeria categorically, in terms of risk, is moderate. So, but what I used to say is that if we're on a moderate categorization for HMPV, it simply means we've exited the low risk. And if that is the case, we must activate outbreak preparedness. All the outbreak preparedness mechanisms and systems need to be activated.
What are they?
And what are they? I'm happy you're asking that. Now, in global health security, number one in preparedness is ability to dictate. Ability to dictate. So we must therefore overhaul the laboratories we were able to develop at the advent of COVID in Nigeria. Okay. Before COVID, we had very weak laboratory system with respect to dictating high-fallating diseases and outbreaks of this nature. Before COVID, all outbreak we had in Nigeria, we had to ferry samples to smaller countries like Senegal for confirmation. But from COVID to date, we now have in-country capacity in this regard. So all we need to do is to make sure that these systems are up and running. At the time, I was in a sister station, and I frowned at the fact that some of the molecular testing laboratories that were provided for in some tertiary health institutions were gathering dust. It need not be so. So I am happy that this is coming, and it will afford us the opportunity to activate all those, optimize them, and put them to real-time use.
So would you say that, I did ask him that, I discussed that with a doctor, that what this pandemics have helped or should help to is to leverage on them, like you're talking about, and improve on your facilities? Would you say, from your experience as a scientist, that Nigeria has been able to do this?
Oh, that has been achieved during COVID, and I will give the credit to the then DG NCDC and, of course, the then management of the Federal Ministry of Health. What were we able to do? Before COVID, we had less than 4 laboratories in Nigeria with capacity for molecular testing for outbreaks of this nature, that of COVID, even things like meningitis, Lassa fever, and all that.
Ebola and the rest of it.
Yeah, so with COVID, that less than 4, was upgraded and expounded to over 90 before we got over with COVID. And that 90 included both public and private. And these labs and facilities for testing are there and they're working. And that's why the NCDC had said that one of the things they've done as response preparedness is to activate and optimize the activities in the testing centers that are contiguous to routes of entry, portals of entry for international travel. Why are we going to really be worried? This is something that was just discovered in China. As we speak today, it has spread to more than 5 countries.
Yeah, it's gone to
Australia. It's gone to France,
Australia.
it's gone to Australia, it's gone to United Kingdom, it's gone to Germany.
But then it is said that it's been there for decades. It's not.
Oh, of course. HMPV has been around for over 6 decades. It's not a new disease, but this is what is happening. It's a viral disease. The etiologic agent is a pneumonic virus. And the worry with viruses is their ability to mutate. And once viruses mutate, they acquire features. Permit my word for that so people can understand.
Okay.
They acquire features that were by default not with them. And this make them now become more virulent. Okay. Yes. And when they establish disease, they can become more fulminant. So it's not a new disease. But one of the things we need to also know is that this disease, HMPV, has a lot to do with equator.
Because they talked about it, it's usually during the winter.
Yes, it is usually during the winter. If you are closer to the equator, you have the disease all time. I mean, you have the virus available at all time. But if you are further away from it, because of the changes in weather, you find out that it's a winter disease. And it has relationship with the traditional causes of flu in temperate region. What are they? You have, of course, the various flu viruses like the respiratory syncytial virus, the SARS-CoV virus, which, of course, a variant of it became COVID-19. Okay. So all other pneumonic-related viruses, that is viruses that have ability to cause respiratory disease. So they are related. If you do a sequencing, you find out that their genome look a whole lot alike. So a few modifications here and there gives us this variant.
I know, we don't have a lot of time. We'll soon be running. The world leaders were supposed to agree on how to handle, after COVID-19 pandemics. They seem not to arrive at that agreement. In the light of the consequences of COVID-19, should you say world leaders have raised the bar in healthcare delivery? And then here in Nigeria, could you say that, world leaders have raised the bar?
Recall that it was international support that we received during COVID that saw us through COVID. We had to open what was called a basket fund, where support from partners, donor agencies were housed, and which was now leveraged to enhance our testing capacity, leverage to provide other interventions, other pharmaceutical interventions, leverage to provide what we call isolation centers. Now, what's happening now is that I think COVID would not take anything like COVID wouldn't take the world unawares. It wouldn't also take Nigeria unawares. But what we really need to invest in is we need to do a whole lot of investment into infection prevention control measures and mechanisms. We must begin to train healthcare workers, especially clinical service providers, med lab scientists, physicians, nurses, and we also would need to educate members of the public on how to actively prevent infections of all types. Not just when we have one like this, we start doing a fire brigade approach. Learning from COVID, we should know that once you hear of any outbreak that is respiratory related, it means you are going to take up your kits and guards as you had during COVID. What are they? You know, the truth about this disease is that it rides on cold weather. And even though we do not have winter in Nigeria, we have what is called in Nigeria harmattan. And harmattan, if you ask me, is more predisposing to disease than winter because it comes with hazy condition. A lot of elements are activated and taken up, causing haziness. Those heavy things that block visibility are particulates that are suspended in air, and as you take them, they are able to cause disease, respiratory disease. So it's time for people to again begin to consider the use of face masks, again begin to consider hygiene, hand washing, and then how do you sneeze, how do you cover your nose and all those. So there's a whole lot we need to do going forward. But then the building capacity and expanding laboratory testing capacity is the sine qua non for containing any kind of disease.
Thank you. Thank you so much, Dr. Casmir Ifeanyi, there, scientist, for being on Prime Time.